Good evening, everyone. My name is Grant Besser. I'm the president of the Boulder Community Health Foundation, as well as the vice president of public affairs at Boulder Community Health. Thank you for joining many other community stakeholders here on this cold spring evening to attend our public meeting on BCH's 2020 through 2022 Community Needs Assessment. Every 3 years, we conduct this assessment with the end goal of 3 different things. 1, we're identifying our community's most pressing health needs. 2, we are putting forward detailed implementation plans against the areas of priority that we identify. And 3, most importantly, we solicit your feedback as community members to make sure this is aligned to what you are seeing and where you think we can continue to best serve the community each day. We are excited to share those plans with you this evening. A few quick notes before I introduce everybody. 1, the presentations for tonight will run anywhere from about 45 to 55 minutes. And then we will have about 30 minutes for questions at the end. What will be great is over the course of the presentations, if you could each use the chat box, which is to the right of your video screen, and chat in questions that you are hoping to be answered tonight. We have a lot of people here, so I'll do my best to make sure that we get through everything to the best of our ability. So without further ado, I'd like to introduce our evening speakers, and maybe you guys could wave as I mention your name. We have Dr. Vissers, our BCH president and CEO. We have Jackie Adelcy-Priest, our vice president of operations and chief nursing officer. We have Jill Erickson, our Director of Nursing for Behavioral Health Services. We have Dr. Elizabeth Cruz, our Medical Director of Quality Improvement and Population Health. And last but not least, Dr. Ben Kaiden, Vice President and Chief Medical Officer. Without further ado, I would like to turn the reins over to Dr. Rob Vissers to take things away here.
Thank you, Grant, and thank you everyone for joining us this evening. I'm incredibly proud of what we're going to share with you, and I also look forward to your feedback, and what a great opportunity to share with you all the wonderful things that are occurring in your community hospital. If we could go ahead and put the slides up. Thank you, Joe. Excellent. And I think we can move on to the next one. This is our community health needs. Actually, probably move through the next few. Perfect. So as Grant mentioned, this is something that we look at every 3 years or update every 3 years. We're active in this during the entire time. But we wanted to share with you what our recent update is. It's also an opportunity to let you know who we are. First of all, we're only one of 2 remaining independent nonprofit health networks in Colorado. And what does that mean? What it means is when we're independent, we get to make a choice about where we invest, where we spend our time, and where we focus in terms of not only the health care, but the wellness that we provide for our community. We're a local community small system. And so that investment and that focus really is on all of you and the community around us. And we have a board made up of community members that helps us make sure that we're achieving our mission and our vision. We're also a nonprofit, which is not that unusual for health systems, but being a local nonprofit, it means that anything that margin that we have, anything above and beyond, gets again reinvested in things that benefit the health and the wellness of our local community. And again, because we're independent, we can choose to spend it on things like mental health beds or preventative care or the social determinants of health. And that's where a lot of these community needs assessment lands as well. A few examples of, I think, the agility and the ability to respond to the community needs. Probably none is more striking than this past year. And while many of you were not even aware of who we are, what we did, and hopefully it's because you were so healthy you didn't need our services, I think everybody obviously was touched by the pandemic in this past year. And because of our size and our commitment to the community, I like to believe that our rapid mobilization engaged in a response that led us to an outcome far better than I think anyone could have hoped for given what we were facing, and also compares incredibly favorably to the rest of the state and the nation. We ended up serving 303 patients with a mortality rate of 10%, which is certainly lower than the national average. When people got here, they were sick. They were here for about a week. We performed almost 50,000 tests, and so far we've really exciting. We've given 60,000 vaccines just at Boulder Community Health. And for any of you that have gone to our clinic, it's really a hallmark of not just care and a very happy place, but the efficiency that we're able to provide. And talk to anyone who's gone there, and I think they've been very impressed with what our team has been able to do. Because of that, and in fact, if we had more vaccine, we could do even more, but we have provided more than half of the vaccines in Boulder County, even though we're just one of 5 health systems represented here. This really is manifest through our strong collaboration and partnership with other health providers in the community. In this case, specifically, Boulder County Public Health was a tremendous partner in working with us. And also making sure that we got out to high-risk populations through our mobile testing unit and now our mobile vaccination unit. It's also an opportunity for me to thank you. The community provided over $2.5 million in donations in terms of our COVID-19 response fund, Feed the Frontlines effort, and to help establish our vaccine clinic. Of course, we were also all touched by the horrible tragedy that we experienced just a short few weeks ago. And we're all still grieving and reeling from this. For many of you may have received the note that I shared, and as an emergency physician as well as a leader of the health system, I can tell you that there was nothing more difficult than to be here ready with 4 incredibly talented and skilled teams of trauma surgeons and providers and nurses ready to deal with whatever came through our door. And the fact that no one was able to make it here was devastating. And probably the only consolation is knowing that we were ready and we will remain ready should anything like this ever occur in the future. But it also represents our readiness every day to deal with the illness and the care for the community. Finally, for those of you that may not necessarily be aware of who we are and what we do, you're forgiven because we were here probably long before, except for maybe a very few of you on the call. Next year, we are entering our 100-year anniversary of serving Boulder County and the surrounding area. And we're very excited to celebrate this and also look forward to the next 100 years of care and wellness that we provide. Next slide. Very quickly, the Foothills campus that I'm sure have all driven past, we have 170 licensed beds. During COVID, we actually created a capacity to go up by almost 50% and more than double our ICU beds, so we can meet needs if it ever gets that bad. We have 12 specialty clinics, everything from a very specialized cardiac and pulmonary care to our incredible infectious disease team that we really relied on heavily this past year. We have 11 primary care clinics of family practice docs and internists spread throughout the region, a freestanding emergency department in Lafayette, 3 urgent care clinics, Gun Barrel, Superior, Erie, that are attached to primary care. We also have an inpatient rehab unit you may not be familiar with in the Brookfield UC Health Hospital, an example of one of many partnerships that we have in order to bring high quality care to everybody. And finally, but certainly not least, the Della Cava Family Medical Pavilion. Many of you on this call were instrumental in helping us build this mental health facility. It's gorgeous, it's state of the art, and it's an example of what we can do as an independent health system to invest in the needs of our community. And we're one of the few systems, despite our size, to invest it heavily into mental health treatment, both inpatient and outpatient. Next slide. There are some things that are important for us, and because of our commitment and also the vision that our board has set for us to do, which ensures access for all of our community members. We are very focused on health equity, and there are a number of examples of things that we're doing to try and address that. But beyond that, or inclusive of that, we also are very focused on the social determinants of health. And while it's important for us to be there when you lose your health, when you're suffering, when you're facing potential loss of life or limb, we're also here to help prevent ever experiencing that through addressing some of the things that can drive ill health, whether it be obesity or smoking or all the things that to prevent access to preventative care. We also provide significant amount of free or discounted health care. We provide over $3 million in uninsured charity care, and we provide almost $50 million in under or uncompensated care. So well over $50 million in uncompensated care. We are also heavily reliant upon the community to support us. In order for us to continue to contribute and to stay independent, we rely on your donations to not only maintain our viability, but more importantly, to invest in all these things we've talked about. And just in the past year, we received $4.7 million, for which we're incredibly grateful. And every dollar goes back to improving the health and wellness of our community. Next slide. I mentioned our vision. About 5 years ago, our board, which represents the community, and other community representatives gathered together to really refine our vision. And we came up with this simple but important statement. Our vision is to foster community partnerships to create and care for the healthiest community in the nation. We absolutely believe that you all can be part of the healthiest community in the nation, meaning not just caring for the loss of health, but creating health. But we also understand that that can't happen without partnering with all of you and everybody in the community that is committed to this goal. Also, to fulfill this vision, we perform a community health needs assessment every 3 years. And we identify the most pressing health needs, or in fact, you do. And we do this through meeting with many focus groups and community representatives. We develop detailed plans and what we need to do to achieve it. And we continue to solicit community feedback to revise and enhance the plans that we have. But our mental health facility is an example of an outcome of this engagement. Next slide. In our 2020 and following 3-year community health needs assessment that we're going to share with you tonight, we really identified, we collectively identified 4 areas. And you're going to hear more about that from the rest of the team. 1 is chronic disease management and traumatic injury. 2 is mental health, including chronic pain management and substance abuse. Wellness and preventative health, including aging of the population and inclusive and equitable access to care. And finally, educating our community through a wide range of programs, something that has exploded over the past year and a positive benefit of our new virtual world. Next slide. At this point, I would like to introduce you to Jackie Atlasley-Prees. Jackie is also a clinician by background, but she is also our Vice President of Operations and our Chief Nursing Officer, and she's going to spend a little bit of time going into detail about the 4 areas I just introduced to you. Jackie?
Yes, good evening, everybody. And again, thank you for participating with us tonight. You can move to the next slide. I'm going to focus first on one of our 4 areas of focus in our community needs assessment, which is traumatic injury. And as we just spoke about our terrible tragedy a few weeks ago, that's one example of us being ready and able to care for whatever type of trauma comes through our doors here at BCH. We are a level 2 trauma center. We are accredited. And we do, along with the actual response when somebody comes in through our emergency room, we also do a lot of outreach activities with trauma as well to prevent that trauma. So some of those activities include giving out with partnerships with our Boulder neurosurgeons and others to provide, and our foundation to provide helmets, for example, for kids on bikes. And so that all helps us prevent that trauma from coming in. But again, very, very willing, able, and ready at any point to accept the trauma that comes with being a very active outdoor community here. The other piece that was already mentioned is we do have an inpatient rehab unit that we partner with UC Health, the Broomfield Hospital. And that's a really important part of a recovery for many patients who experience trauma, whether that's head trauma, whether that's other types of spinal injuries or orthopedic injuries that may need to be an intensive rehab program at our inpatient unit. And then, of course, even with COVID, our emergency preparedness and response system has really been heightened over this last year as we responded to the pandemic, as we prepared, as Rob mentioned, to be able to increase the number of beds. Did the surge exceed our normal capacity, which I'm happy to say that we were able to only add a few beds at a few points in time in order to accommodate all of the care that was required in our community, including COVID. As well. So the next slide. The next need identified that Dr. Elizabeth Cruz is also going to comment on is chronic disease management, and then the ever important access to the care that we provide here. So some of these chronic diseases need the latest and greatest treatments that we can provide here at Boulder Community Health when they need more advanced or hospital treatment, or hospital-based treatment. So for example, I'm just using one, heart disease, which of course is something that we do have the ability to be able to treat in new ways. And we have added some very talented providers onto our medical staff and our employees of BCH, for example, to deal with the heart through an interventional means. So instead of having to have an open heart procedure where they have to actually literally, as you know, cut open the chest, we can actually do those in interventional ways by sending a catheter through a leg vein, for example, to go up and actually replace a valve in the heart, which is just incredible. The talent that we have here, as well as the ability and the infrastructure to be able to support that. And in addition, we also have a cardiac surgeon, Dr. Dan O'Hare, who does robotic surgery now to also replace some of those similar kinds of things, valves. And again, it's a little bit more invasive than our interventional program to replace those valves, but it's a very small incision. Again, not a huge chest opening procedure that many people go through. So that's all very exciting. One of the other ways we are certainly advanced our ability to help our patients stay healthy or to deal with their chronic diseases and to have access to care in a different way is through our new electronic medical record, which is called EPIC. And a part of that is having a patient portal, which is called My BCH. Any of you that haven't yet can certainly sign up on our website for a My BCH portal account. And that gives you access to different aspects of your healthcare and your record directly to your iPhone or to your phone, as well as to be able to make an appointment, for example, or to request an appointment, or to send a message to your provider or your physician who you want to communicate with in a more convenient method. So we really feel that that has really advanced our ability for our patients and all of us to help support you in chronic disease management, to stay healthy, and of course, to have better access to care. And I think Rob already addressed the health equity. It is a real focus for us. Recent examples, as was mentioned, would be our work with the county of public health to be able to do, first of all, in the beginning of the COVID pandemic, to do testing in a mobile clinic. So we took those up to some of the more rural areas of our county, like up in the mountain communities, and to some areas like our homeless shelter, to be able to serve those individuals that don't often have easy access to testing. And then now we've turned that into also a mobile vaccine clinic, which is very exciting. So we're also reaching the vaccines to individuals that would not otherwise be able to get to our beautiful clinic here on the campus. We also have many partnerships with some of our other community providers, like the homeless shelter, to be able to have some of our staff work very closely with those providers there to be able to provide healthcare directly at the shelter. Next slide. And then another need that we identified in our process through our community assessment was community wellness. And of course, our clear vision of creating that healthiest community in the nation was really important to us. So many of you might be familiar with what we had prior to the pandemic, which was Walk with a Doc, that has now been transformed virtually into Be Well Saturdays. But that's a really great way for us to be able to share information, education, and have an activity that went along with us with that when we did a Walk with the Doc, but really to help all of you to be able to support your health and wellness. We already talked a little bit about under the trauma and injury prevention that we do have a lot of partnerships to be able to provide child and teen safety. And we also do that with older adults with a fall prevention education program partnership, as well as an assessment. You can see we also have a car fit program, again, for our aging community. As their bodies change, it is more challenging to have a car that seat and other pieces now fit you. And so we do have a therapist who help with that car fit program. And then in a few minutes, Dr. Ben Kaiden will be talking about our robust community educational activities. Again, all aimed at both physical and mental health activities, and how you all can help keep yourselves healthy, as well as how we can support you in staying healthy and treating in any disease processes that you may be experiencing. So the next slide, please. And I believe I'm turning it over now to Jill Erickson, again, our Director of Nursing for Behavioral Health Services, who's really going to focus in on our community needs around mental health.
Hi, everyone. It's so wonderful to be here with you tonight. Next slide, please. So as far as what I'm about to present you, I'm very excited and I'm very proud of Boulder Community Health because what we're about to talk about here is something that's very different than most organizations are doing. Most organizations have really shied away from or stopped offering mental health services, related to chronic pain and substance use. And Boulder Community Health has really gone forward very courageously in recognizing that a healthy community is not just a medically healthy community, it is the whole person. And all of these initiatives are just evidence of that commitment. Also, what's very exciting about this is everything that we have done so far lays a wonderful foundation, and we're very proud of it. But through partnerships with our community stakeholders, we really feel like we will be able to nurture and cultivate these programs to build upon and to partner to provide a very comprehensive mental health, substance use, and chronic pain service lines. So within that, as I talked about partnering, so we have mental health partners who we partner with. Bridge House is another one. Those are all community members who provide huge lengths and breadths of services. And that's what we're really looking to do, is to align our service lines, make sure that we communicate well with each other, that we support each other, and that we can create a community-based mental health program. So within this, we also have as I mentioned before, we want to cultivate and nurture our necessary programs and funding along with this. And so we have a lot of different strategies in which we will do all of them. And one of them is the Community Mental Health Initiative. And this is something that BCH participates with mental health partners. And it's really about improving the continuity of care with our mental health community, making sure we communicate well and everything that we should. Then there's also the community support through the BCH Foundation. This has been just paramount for us. We wouldn't be here where we are without the BCH Foundation. They've helped us form partnerships, helped us fundraise and provide funding for pilot programs in which we can really try interventions and measure them and see if they would be a good overall project. And the last thing I have on here is the Anchor Point Mental Health Endowment. And this is something that I'm so grateful for, and I really want to give a shout out for, because this is through the BCH Foundation as well. And it's something that we use quite heavily for to address the social determinants of health. And so it could be anywhere from paying for prescriptions, covering rent, making some car payments, paying for therapy, even a bus ticket back to the family. And this is all stuff that normally doesn't get addressed within the mental health system because most places do not have the funding to do this. Next slide, please. And so with that, what have we done with this and where are we going? So our ambulatory team has done an amazing job at integrating behavioral health into primary care, because they really saw that people were maybe getting into primary care, but their mental health needs weren't being addressed. So they added social workers who work with to help the patient navigate the system. They can consult with the primary care doctors, and they really they provide therapy, short-based intervention therapy. So they've just been absolutely consequential. The other thing we're looking at is mental health navigation. This is through the BCH Foundation. We'll be funding a mental health navigator to help people navigate the system. And if you've ever had a loved one, or if you yourself have been within the mental health system, it's extremely challenging to navigate. And for people in crisis, just to try to find who takes their insurance, what therapists are taking patients, and who can see someone with their primary diagnosis can sometimes take weeks and weeks. So we really want to reduce those barriers. We also have what we call the BHEART team, and this is the Behavioral Health Addiction Response Team. This is another thing that BCH really goes above and beyond as far as having specialists for such as what's considered a smaller organization. We have a psychiatrist and we have a psychiatric nurse practitioner who round on the medical units and help our teams address our patients who are suffering from having medical challenges along with mental health challenges. And the last thing I have on here is the Della Cava Family Medical Pavilion. And this has been an extremely unique and humbling experience. And I say that because if you've ever seen a lot of mental health facilities, it's generally not a calm, beautiful, open, lit environment. You know, we do what we can where we have space. And this is a totally unique experience. It is beautiful, it is therapeutic, it is safe. And I can't tell you how many patients and families have commented on how they feel like they are seen, they feel like they are important and validated, because not only does the team care, the interactions, but the facilities prove that this is a priority. And within the Family Medical Pavilion, we have the BCH Counseling Center, and that's a little mental health clinic. We offer psychiatric care, individual therapy, and a group therapy called intensive outpatient. The next we have is inpatient behavioral health, and that's our behavioral health unit, and we have 18 beds. We have, it's just so beautiful, and we're so grateful for it. We also have electroconvulsive therapy, which is a procedural area that helps people with long-term depression who cannot take medications. And then also we have a partial hospitalization program coming up that really focuses on nature and how nature can be used as a coping mechanism to help us feel grounded and engaged with our environment. Next slide, please. And for this slide, we have, the chronic pain management and substance abuse. So this is a really, it was a newer initiative a couple years ago that came about due to a grant. And it's called PILLAR, Prevention and Intervention for Lifelong, Alternatives in Recovery. And this program consists of a program coordinator and patient navigator. And a lot of the similar ways that I talked about the mental health navigator, the substance use navigator will help people navigate through just the different kind of treatment issues that they have, referrals, therapy. And it's really been incredible. So this is through the Substance Education and Awareness Grant. The opioid reduction programs are educational outreach to support our best practices. And it's really to focus on reduction of opioid prescriptions and non-opioid choices within pain management. Our BCH surgery and labor and delivery areas have really shown a lot of success with this and really reducing our community's reliance on opioids while giving them alternatives and being able to control their pain. And the last thing I want to talk about is the Center for Mind-Body Medicine. And this is a very, very cool place. This is where people who are having chronic pain issues can go and be taught meditation, mindfulness, alternative pain techniques. It also has acupuncture. And, it's really wonderful because our program coordinator and our patient navigator through the PILLAR program work quite closely with this clinic. And as I said at the beginning, this is just a brief overview of what BCH is doing, but it is by no means what is presented as a comprehensive, this is all we're going to do. This is just how we have focused on it, how far we have come, and also all the great work that's going to happen. So thank you for being such an engaged, supportive community. You provide us the inspiration we need to continue on this road. Next slide. And next, I'd like to introduce Dr. Elizabeth Cruz. She's the Medical Director for Boulder Community Health and the Boulder Valley Care Network.
Thanks very much, Jill. And I'm glad to be here and have the opportunity to talk about what we're doing in our ambulatory primary care clinics. So Boulder Community Health sees over 67,000 patients within its primary care clinics, and the number of patients almost doubles when all the patients within the Boulder Valley Care Network are counted. Preventative services are, of course, an important aspect of creating the healthiest community. Our approach to population health is to regularly review our total panel of patients and find those who have not been seen or who are due for routine screenings and preventative care and get them back into the clinic. In our clinics, we also, as has been mentioned, regularly screen patients for risk of falling, depression, as well as for those social determinants of health like food availability and housing instability. We also have specific programs in place to improve certain measures of healthcare quality, like influenza and HPV vaccination. And we use data transparency and process improvement to increase these rates with the goal of beating national benchmarks. We have regular outreach to patients who have identified so-called gaps in care, and these are done electronically via our patient portal or by a phone call or by mail. We also collaborate with community partners to ensure that our patients get the help they need. In short, we really try to make sure our patients get the right care in the right place at the right time with the multiple services that I'll be describing in the next slide. So next slide, please. So chronic diseases and conditions, of course, such as heart disease, strokes, cancer, type 2 diabetes, obesity, and arthritis are among the most common, costly, and often preventable of all health problems. The goal of our chronic disease management program is to improve health and the quality of life while increasing value and decreasing the total cost of care. And BCH has invested heavily in personnel and technology to achieve these goals. We also partner with community organizations such as the Boulder County Area on Aging to identify and refer patients whose overall health might be improved through a support group or through caregiver training. So Live Better is what we call our primary care team approach. We have several team members, of course. The head of the team is, of course, the primary care provider, which could be an MD, a DO, a nurse practitioner, or a physician's assistant. They lead the team, but also very important is our RN care managers and transitional care nurses. All of BCH's primary care clinics have an RN care coordinator on site who works to educate and coach patients with multiple chronic conditions in self-management of their chronic disease to prevent complications and improve their health. In addition, BCH has another team of nurses whom we call our transitional care nurse team, and they focus on education and support for our highest risk patients after a hospitalization. This latter team focuses on high-risk patients with diagnoses of pneumonia, congestive heart failure, who just perhaps had a heart attack, who have chronic obstructive pulmonary disease, or who just had coronary artery bypass grafting, or perhaps a lower extremity joint replacement surgery. The team aims to help these patients avoid readmission to the hospital by utilizing strategies such as ensuring that the patient understands their discharge instructions, their medications, and how to take them, and that they understand their disease state. They basically help these patients and support them in their transition from the hospital to home and make sure it goes smoothly. Our nurse care managers in the primary clinics also provide a similar discharge follow-up for patients who don't fall within these diagnoses managed by our transitional care nurses. These nurses also provide education on accessing appropriate levels of service and the availability of extended hours and same-day appointments in our primary care offices. They monitor patients who have chronic diseases for signs of disease relapse or deterioration and help these patients return to care and hopefully prevent unnecessary emergency room or hospital visits. All of our nurses collaborate with other services across our BCH departments, across our community and other agencies, as well as skilled nursing facilities and social support organizations to help provide our patients with coordinated care when and where they need it. Our team also consists of a pharmacist and ambulatory pharmacist who focuses on improving the management of our diabetics whose blood sugar may not be optimally controlled. She actually provides direct education to patients and medication management in collaboration with our primary care physicians. We also have a diabetic educator. She's actually a registered nurse as well as a registered dietitian, and she provides individual consults for all primary care clinics, as well as group diabetes education classes for patients. She offers pre-diabetes classes that are open to the public throughout the county. And BCH also has added the capacity to provide on-site screening for diabetic eye disease, point-of-care testing for important tests like hemoglobin A1C, and she offers diabetic education and medication management during these visits. Future plans include expanding group visit opportunities across our network. BCH also partners with several other prediabetes programs, such as the YMCA Diabetes Prevention Program and the Area Agency on Aging's program, to address our pre-diabetic population. We also have an after-hours nurse advice line staffed by nurses to help patients get the right care when our clinics are not actually open. In addition, we have 3 endocrinologists who work to assist in the comprehensive care of our community. And to serve our aging population, BCH is steadily adding capacity within its primary care clinics to manage chronic conditions associated with aging, such as dementia. Care management will be augmented by early identification of disease, outreach to patients and caregivers, education on their disease processes, and partnership with community organizations to assist in the congruent care of our patients. And to assist these patients, in addition to our strong primary care team, we have a team of neurologists in Boulder, as well as a geriatrician working with our internal medicine clinic in Longmont. And so that's really just a cap of what we are doing in our ambulatory care clinics. And that's all I had, so I'll hand it off to Dr. Kaiden, our Chief Medical Officer.
Hey, good afternoon. Thank you for having me. Let's see here. I'm going to talk about community education. And, I think what you'll see is there's a lot of overlap here in the education offerings that we have that really focus on the whole suite of prevention of chronic diseases, prevention of traumatic illness, as well as, novel treatments or routine treatments for all of the above. And so in 2020, as we talked about a little bit earlier, was such a traumatic year for us in so many ways. And when we talked about how to pivot our educational programs in the face of COVID-19 and the restrictions around social gatherings, we really super impressive in that we did 32 lectures throughout the year that were online and actually increased our viewers to our lectures more than 200%. The lectures really span the gamut from childbirth and parenting classes, perinatal classes, joint replacement classes that we do before people have total joint procedures, and also injury prevention, which is a very cool program where we actually have our team members go out to different locations to help children and also adults get helmet fitting for their bikes, and making sure that we can try to prevent bike-related traumatic injuries. And unfortunately, we see skateboarding-related traumatic injuries. And so that has been a very impactful part of our education program. We also do things like hands-free, hands-only CPR, stop the bleed classes, which are ways to help people deal with traumatic injuries and help control bleeding in the field. And then, of course, as I think some of the other speakers have talked about, we partner with mental health partners and Rotary, the Boulder County Area of Aging, Bridge House, and the Boulder Shelter to just to have combined educational sessions related to areas of interest for those populations. And often it'll have BCH experts alongside experts from the community to help educate the teams. Sponsorships, we've done a lot of financial and in-kind support to organizations that are providing similar care. And I think we've discussed the Bridge House partnership to help get homeless individuals back on their feet and job training, and actually provide some work at our partnering cafe, for example. Next slide, please. I would be remiss if we didn't talk about all the education that we did during COVID-19. And, I think even to this day, when you read the newspaper or you listen to the radio, there's lots of information that may be relevant nationally or internationally, but I think it's very helpful to have local experts, like you can see Dr. Amy Meditz holding those signs there, Dr. Mark King, who've taken the lead on community education around COVID-19 from the infectious disease perspective, and then others like myself and Jackie and Rob, partnering to bring local accurate information to our community around COVID-19, around our hospital's preparedness, how we're dealing with the surges that we've had, how we're dealing with vaccination. And we did many meetings with the Boulder City Council, with the Boulder Chamber. We did community town halls related to COVID. We did lots of work around community testing and education. And we right now are focusing a lot on vaccination. And so I guess I'll take this opportunity to make a plug that if any of you listening have not yet been vaccinated and are interested, you can log on, get onto mybch.org and schedule your vaccine. We're vaccinating anyone 16 and older right now. There's no other restrictions. And we're seeing the positive effects of vaccination as our hospital has roughly, today, one patient with COVID and 1 to 2 over the last few days. And we haven't seen a healthcare worker at BCH that's been vaccinated have an infection since the beginning of our vaccination campaign. And we're seeing dramatic reductions in mortality and hospitalization since we began vaccinating. So I'd encourage you and your families to get vaccinated. A couple other educational topics I think I didn't quite touch on, but they were discussed earlier, was lots of substance abuse education around medical assisted treatment, other options for treatment for substance abuse. And because COVID, I think, has really triggered a lot of anxiety, has raised the risk of substance abuse. we've done a little bit more education related to mental health and substance abuse over the last year, in part, which is directly in line with what our long-term strategic plan has been to really create a whole person approach to health, including physical and mental health, as Jill described so nicely. And so we've done lots of work on that. And then that's all community education. We do lots of that. We also have done significant work around provider education, whether that be the BCH providers, our medical staff, our partners in the community. And because the more that we're up on the latest and greatest, then we can translate that to our community. And I think I neglected to mention Be Well Saturdays, which Jackie touched on a little bit, but that we've used that in our Walk with the Doc program to also address community preventive and other educational topics that have been really well attended. And that's another way we're trying to comprehensively address the educational needs. Next slide, please. So I'm going to just pivot a little bit to talk about the hospital transformation program, where we want your community impact or your community input, around this. And so this is a goal of the state of Colorado, focusing on the Medicaid population and trying to improve outcomes and experience while reducing cost. Through really doing what we call value-based programs, where we focus on a lot of the things Dr. Cruz just talked about, whether it be case management, RN or nurse care managers, behavioral health support, better communication between the hospital and clinics, whether they be our own clinics at BCH or whether they be clinics throughout the community. And so there's key metrics that we are submitting later this month to that we will be partnering throughout the community to try to reduce the cost of care while improving the outcomes. And this is kind of an exciting further development of this total person care that we've been working on for quite some time here. And also, as Rob talked about earlier, social determinants of health, we all know how important those are. So we have embedded into our record system and our daily processes when we see patients to collect information or screening about social determinants of health, such as problems with food security or homelessness or other social concerns that are affecting health, so that we can then connect or provide resources. And, they're fortunately in Boulder, whether we have them internally at BCH or we have partners that we work closely with, there's a lot of resources in the community. And I would say that for the substance abuse related issues too, we have lots of partners that we work with. And I think one of the hardest problems is connecting those dots. And that's why Jill was talking a little bit about navigation. And so we have navigators to help us connect those dots when we have patients that need resources like this. And then the other part of the hospital transformation project has to do with improving access to specialty care, specifically for Medicaid patients, and treatment of opioid dependence, which we've talked about, expanding what's called medically assisted treatment, which is a medication used to treat opioid addiction that has very good outcomes. So we've already worked pretty hard over the last few years to make that available in our clinics, but also partnered many clinics outside of BCH. And then really importantly, beginning treatment in the emergency department when people show up after an overdose, where they're at very high risk for a recurrent overdose and death, offering them treatment if they want it and getting them on treatment immediately. And then sometimes in the hospital itself, whether it be in the ICU or the medical floor, we have providers that are experts in treating opioid dependence. So really a bit of a pivot from previous days where it was more counseling and recommending abstinence to providing a suite of options. And then, as Jill Erickson talked about, this alternatives to opioids. So whether that be different medications or whether that be things like physical therapy, acupuncture, mindfulness-based treatments, increasing our alternative to opioids while reducing our opioids. So certainly the goal is not to neglect pain, but to treat pain in the most effective and safe ways that we can. And then part of the HTP is to create a data system that we can work with the state so that statewide our Medicaid population gets the best care necessary. And we know that Medicaid is increasing with as a consequence of the pandemic. So this only increases the need. So I encourage you, if you have input, whether you want to raise it in the chat or in questions tonight, or to go to our website, there's more information on the HTP program, and we welcome your input on that. Next slide. And I think that concludes our remarks. I'll turn it back over to Grant, and we welcome your questions.
All right. Good to be back, everybody. Hopefully that everybody can see me at this point. Ben, thumbs up. Excellent. So if all the panelists could unmute their phones and join me here on video at this point. I hope that everybody found the snapshot of all that we are doing across the key priorities that have been identified as part of the community needs assessment to be helpful. Now's the fun part of the evening. We want to hear from you. You know, what is on your mind? We've been getting a lot of questions already. As a reminder to everybody, there's a chat function next to the video screen, so feel free to chat in, and I will do my best to make our way through all the questions. We have about 30 minutes in total to accomplish that. So let's dive right in. Excuse my shuffling around with all the questions that I have here. A big theme, and actually a number of questions that have come in, have been specific to health equity and culturally competent care and social determinants of health. I'm gonna ask a couple of questions related to that. One is, how are we factoring in health equity into our vaccine rollout strategy, including individuals that may be undocumented in our community, creating a safe environment to pursue, or specific populations such as the LGBTQ community as a whole? Probably start with Ben on that question.
Yeah, thanks, Grant. That's a great question, and something we've been doing a lot of thought of around, and I think there's always more work to do, but I'll tell you what we are currently doing. First of all, we are providing vaccination free of charge. There's no out-of-pocket charge to all individuals, whether they be undocumented immigrants, U.S. citizens, green cards, etc. And I had the pleasure of verifying that, because I had a patient who was undocumented immigrant who needed to schedule his vaccine, and we scheduled him and his spouse and his brother, and it was great to see how smooth that worked. And then the other approaches we've looked at is reaching out to some of our community partners to make sure that everyone is aware that this is the case. And then Jackie talked about our mobile clinic, which initially was a testing strategy, but we always were prepared to pivot to vaccination. And we've been working really hard with the county to aggressively increase the number of vaccines we can get to our areas of need. And so we've done a couple over the last week or so, and we will do more, basically going where the county tells us to, where there's a need. If there's a need in Netherland and the mountain communities, we're going there. If there's a need at the homeless shelter, we'll go there. And if there's a need really in any community, we're available and ready. And I'm not sure if there was other questions or if I answered that, but feel free to remind me.
Yeah, absolutely. I think it's a good start, and we'll actually hit upon it more in some future questions here. This next question is actually addressed to Jackie as it relates to culturally competent care, and how do we think about that within our education, within our overall governance, of clinicians, and what do we do to help educate?
And I think it's a really great question. And the term cultural competence is a little bit of a misnomer, because none of us can walk in the shoes of another culture. And we probably all belong to a lot of different cultures. But really what I believe the intent of this really looks at, how do we teach to, how do we educate to, how do we coach each other in being, having an attitude towards, or a lack of attitude maybe, towards different cultural groups. There's the cultural groups could be the ethnicity, and it certainly could be a lot of cultural things around language and around their cultural customs. But it's also about gender identity. It's about education levels. It's again moving into those spaces with those patients or our ones that we're interacting with, because it also applies to each other as healthcare providers as well, without judgment. You value them. You ask questions and you learn about what's important to them and what's important in their culture through being a good listener. So our listening program, for example, that we did across BCH really addresses how do you hear what the patient is telling you, and how do you pause and really approach the care from their needs versus my needs as a caregiver. And so that's what we do here at BCH, and we continually try to learn and grow in that area and in that space, individually and collectively as an organization.
Hey, Jackie, you mind if I just add to that, just exactly like you said, we're continually learning and growing. And so we have a scheduled implicit bias training for our medical staff in, a month or so at our annual medical staff meeting. And we're partnering with the CU School of Medicine and some experts there to help our medical staff, physicians, PAs, and nurse practitioners, learn a little bit more about implicit bias, meaning bias that's below the surface that maybe is not recognized by us as providers. Maybe we're not thinking that because of a person's ethnicity or race that we may think a little bit differently subconsciously. And so we're doing a training to try to, help us learn and grow as the research around this type of bias has grown over the last, 10 or so years.
Great. Thank you, Ben and Jackie. Jill, got a question for you here related to mental health. Recognizing the complex navigation within the behavioral health space, whether at BCH or externally, what resources do you provide families that are struggling with an individual and thinking through kind of the best path for that individual? So whether it's education or navigation, do you have some examples there? You're muted, Jill, I believe.
Hello?
Perfect.
Okay, yeah, yay. All right, that's an excellent question, because it really does come down to how much empowerment, support, education can we give to clients and family members. So what some services that we have is we have wraparound case management services. And that's what I had spoken about before, which is so tied to the Anchor Point Mental Health Endowment, because that is the wraparound case management services really identify and focus on the social determinants of health and the challenges and obstacles, barriers that lie in the way of someone achieving their highest level of quality of life, of satisfaction. And it really is about housing, transportation, prescriptions, food, clothing. And so wraparound case management is huge, and it is the platform in which a lot of the others are built. And from that point, by adding substance use and mental health navigation, our case managers are able to hand off a case or a client to someone with their family who's really like, here's what we set up. And now from this point, I'm going to hand you over to this person and they're going to help you. They're going to check in with you. They're going to see, how are you connecting with your provider? Do you have transportation to your appointments? Do you need help rescheduling your appointment? So those are some ways that it's, instead of someone having to seek us out, we are actually able to help them, stay with them and stick with them throughout. And so that way, if they have to come back to the hospital, they have someone who they can talk to. And I would just really want to call out, because I feel like the behavioral health specialists in the primary care clinics are just just incredible with what they do. So they do, as I talked about before, as far as helping individuals. So if someone comes into a primary care clinic and the provider notices that they have substance use or mental health needs, they'll bring in a licensed social worker, and they can provide either brief solution-based therapy. They can provide referrals, help with navigation, and also provide support for the primary care physician who may not have as much information about what this patient is dealing with as they'd like. So those are just some broad interventional areas that BCH has implemented and is continuing to work on to provide expansive services and really remove the confusion and give mental health and substance use and chronic pain transparency. And so we're able to communicate. We know how it works.
Excellent. Thank you, Jill. I believe this question is probably directed to Dr. Kiden and Dr. Cruz, but with the senior population demographic as a whole rapidly increasing as a percent of the total population across Boulder County, but especially in the city of Boulder, how are we thinking differently, I guess, in terms of our care senior population, and what are we doing to evolve our work there? So either Elizabeth, you want to take it?
I don't know if you want to go ahead. I mean, I think like I spoke about, I mean, certainly we focus a lot on screenings to try to make sure that people are safe at home. We already have a lot of our embedded nurses who can help patients find help in the community. Like if you need someone to visit your home to help you out with housework or transportation, or even cooking, those kinds of things. We help you find those kinds of services. We also can arrange for, home health care if you need it. And we also actually, I think, if there's anything that has been good about the pandemic, I think it's our foray, or finally our foray into telehealth. I mean, I think we've been talking about telehealth since I was in residency, and now we're finally doing it. And I think for certain populations of our patients, for a variety of reasons, who find it difficult to get into the doctor's office, it can be a great way to maintain that continuity of care and make sure people don't slip through the cracks without having to bring them in, have them park, and take all that time out of their day. And I think, as Jill mentioned, behavioral health is a huge issue, I think, for our aging population as well. So having those resources, I could say as a primary care physician, is extremely valuable, and also valuable for our patients. So I think we want to continue to build on what we already have, continue to build those partnerships that we have created already in the community. And yeah, just continue to build on those things.
I'll just add a couple brief points around that. Like, for example, I saw a patient today who had been in the hospital and then had been in a rehab and then was just discharged from the rehab facility. And I got a note from the transitional care nurse that Elizabeth talked about earlier, who had visited the patient in the rehab and then had called them after discharge to make sure they were okay and that their meds were correct. And then I had a chance to see them and kind of review and maybe answer a question that they might have had that needed a physician's input. And so all those services that we've built over the years that Elizabeth spent some time earlier talking about, they're even more important, I think, as you get to be older and your disease is more complex. And sometimes we call this like high touch primary care, like where we check in more, So if you're, I'm not sure if people know what we mean when we say nurse care manager or nurse, transitional care nurse. But what we're talking about is we identify people with higher needs because of their age and maybe multiple medical problems. And we call them regularly and we check on them and we make sure that we're answering their questions proactively instead of, maybe you stumble across them when they are in the office. So it's a more of a comprehensive approach as opposed to just in the office. And I think that social work is part of that too. And our social workers have been doing remote work for a long time, and it's been really successful. So I think that work is even more important for our older population. And then there's one other point I would just say that Elizabeth and I have worked a lot on over the years, which is embedding and making advanced care planning. So talking about goals of care, talking about what matters to people as they age, and documenting that so it's in the chart, and we can see that when they come to the hospital and then they leave the hospital, maybe there was more discussion and it's obvious, and so that we can respect people's goals. And I think that's something we're continuing to focus on, and actually that's part of our sort of emphasis over the next year in our primary care and specialty populations.
Excellent. Dr. Kite, Dr. Cruz, thank you. Dr. Bissers, a question for you, very direct. Is it safe to pursue my healthcare right now?
Can you repeat that? Safe to what?
In light of the pandemic, is it safe to pursue my healthcare right now?
Pursue your healthcare. Yes, absolutely. I would say throughout the entire pandemic, I felt very safe coming to the hospital and other healthcare facilities, but the avoiding your care, delaying your care, choosing to put off something is by far riskier than addressing than your worry about COVID right now. Certainly by seeing your healthcare provider, we were able to provide care for thousands and thousands of patients, including COVID patients, in an incredibly safe way, and for our employees as well. And I still feel like it's the safest facility in the county to walk into. And if you walk through, you'll certainly see why. But also, now that the immunizations are so prevalent throughout the county, and we continue to provide the safe precautions, I can tell you as of this morning, and it's been the case for several days, we only have one patient with COVID in the hospital, and we've only had a few for the past several weeks. This is compared to before Christmas, when we were pushing 30 patients and multiple patients in the ICU. So it's working and it's effective. But regardless of that, the presence of the COVID, all the precautions are in place to protect you. And your biggest threat right now probably is your other healthcare needs that are unmet.
Excellent. Thank you. Rob, I'm going to ask you another question while I have you up here. Related to the uniqueness of our independence. I guess a two-part question. One, how does our independence enable us to better serve the community? And then two, what is the greatest threat to our independence?
Yes, the fact that there's only two of us, certainly independents along the Front Range, and you could argue that our health systems across the state, the other being down in Pueblo, begs the question of why. And clearly it's challenging. And so I think that's the first thing to answer is why remain independent? Clearly it may be an easier path to join the system around us. And we are surrounded by a number of very large systems, some of them based in the state, some of them based across many states, and some of them based in states outside of Colorado. I will say that the care that we enjoy in Colorado is very good. The systems around us provide generally very good or excellent care. And I think you're safe going to any of them. The challenge is that when we looked at this and we asked this question in earnest, when you become part of a larger system, you inevitably lose the connection to the community. Decisions about where the margins and the investment of healthcare and preventative care takes place goes outside of the community, and you're not able to make those specific investments, but also respond to the needs of the community around you and the one you serve. There's also great data that supports this, and so when smaller organizations like ours join big systems, the primary reason is for financial sustainability. And the reason is that when you join a larger system, they generally are able to garner higher rates, higher reimbursement. Unfortunately, that also means higher cost. And so when a smaller system becomes part of a bigger system, costs invariably go up. Care leaves the community. Part of that scale is pulling patients into a central area, perhaps far from the community or your family and loved ones. And there's no evidence that quality goes up. And in fact, there's some evidence that in some cases, quality tends to go down. But most importantly, we lose that autonomy to make the decisions about the care we provide, the type of care we provide, and the investments we make in the health and wellness of our community. And we absolutely are committed to that. It's not easy though. And the biggest challenge with remaining independent is the financial sustainability. And we believe in the need to keep our margins small. We're a nonprofit. We need to make enough money that we can reinvest in all the things like the Delacava Pavilion and mental health and the many things that we've touched on in the last hour that unfortunately most of them, while incredibly valuable to our community and to all of you, aren't necessarily financially valued, whether it be by payers or Medicare or Medicaid. And it does require us to subsidize that care. It's absolutely worth it, but it puts us in a tenuous financial position where if we are going to remain financially viable, but enjoy all the benefits of independence, it means we still should be committing our dollars and our focus on all the things we've talked about: social determinants, mental health care, access, equity, and so it's maintaining that balance. And otherwise, why be independent? I would say that the greatest threat to our independence is we are in the middle of and experiencing a time of incredible change and pressures on the healthcare system to appropriately be more affordable and to demonstrate value to all of you. When you have rapid change and you have a number of stakeholders involved that may or may not be directly invested in or understanding something as complex as healthcare, sometimes that can lead to negative outcomes. For example, the public option that we're seeing right now, while it may improve things for a small segment of the population, for us, it represents a significant hit to our revenue and ability to sustain some of the things that we want to do to invest. And when you have some of these massive changes in a short period of time towards a complex system, it does disproportionately impact smaller community healthcare systems, rural systems, independent health systems that have small margins, that can't afford to take a 2% margin hit, as opposed to some larger system or for-profit systems that can absorb these kind of changes to some degree because perhaps they haven't invested as much in the community health and wellness. So having said all of that, I have incredible faith in our resiliency. There's a reason we've been here 100 years. And we recognize that being independent doesn't mean going it alone. And we are successful because of a number of valuable partners and working with those that do things, frankly, better than we can. And together we can have better outcomes, whether it be partnering with a nonprofit like Bridge House to enhance the health and well-being and providing shelter care and a sustainable job for the homeless, whether it be partnering with UC Health to provide a state-of-the-art rehab unit that individually we never could have done, to many other opportunities. And so we intend to use our size to be nimble and to be thoughtful and to innovate, to make sure that we're always there, not just to provide the basic care that you need, but to do it in a cost-effective way, and to do it and to invest all the things that we need to provide the global health of our community. So it's not easy, but it's a fight worth fighting for.
Excellent. I do appreciate the comprehensive answer there. Couple of questions here. Maybe Dr. Kaiden next. As you're talking about the vaccine efforts, you referenced our partnership with Boulder County Public Health, was started with the testing effort that has now turned into the vaccine effort. Could you speak a little bit more to that as it relates to cultural competence and being in communities, and then kind of what would you hope for that to look like in the future, recognizing it's a little bit crystal ball?
Yeah, I think that's a great question, and I will say that our partnership with Boulder County, we've always partnered with Boulder County, but we really began our scaling up of that partnership prior to COVID with opioid, the response to the opioid pandemic. And I think they were great partners and they had a lot of resources and we worked together. And the city of Boulder actually provided grant funding for our opioid and chronic pain response, which is how it was initially formed in the first phase. And so we got to know our Boulder County Public Health team a lot better through that effort. And when COVID came, it was obviously a public health crisis. And we recognized that they have a lot of expertise around cultural brokers and community engagement. And we have expertise in care delivery. And, it turns out they don't have a lot of people that can vaccinate or they don't have clinics. And so we all together recognized that we had to partner. And I think all the community partners, all the other health systems also got into that effort. But we took a leading role, maybe because of our location and partly because of our nonprofit and our local status. But we just sort of doubled down and said, we're not backing away from vaccinating, and we were losing a lot of money in vaccinating, especially at the beginning when it was unclear how we were going to be paid. And I think it's a testament to Rob and Jackie and our leadership team that we said, we're going forward, we're vaccinating, and we're going to vaccinate as many people as we can, as quickly as we can. And then we went to the county and said, we understand there's equity issues and we want to help you solve them. And we worked really closely with the folks at the county to say, what can we do to reach more difficult communities? What can we do to use our mobile vaccine clinic? How can we partner with the foundation that you lead, Grant, and where we got a donor to support our mobile, our car that we take out. And we said to the county, they were like, well, maybe we can work on finding money to get you a car. And we said, we've got that covered. Can you help us locate where we need to go? Help us with some logistics. We were hoping they would be able to help us get vaccine, but that has not really been the case. And so we've just worked with them primarily around the cultural brokering. Like, they have connections. We know that people want to be vaccinated closer to where they are comfortable and with people that they trust. And so we're trying to work with them to say, how can we take our resources, whether that be vaccine, whether that be vaccinators. You have to be able to respond to anaphylaxis, for example. And so how can we take our expertise and be there for you? And, I think that's our approach, and it's been a constant partnership.
Excellent. Thank you. And I think it's fair to say we're learning, right? And I think we're also learning through our partnerships with organizations such as Boulder County Public Health to determine what we can do today, but to also push on what we can do in the future. So,
well, and I'll also mention, Grant, right now you talk about this fourth surge of COVID, and what we're seeing in Boulder is really not a major surge in hospitalizations or deaths, but we're seeing a surge of infections in the younger populations that aren't yet vaccinated, primarily 45 to 54 and 18 to 22. And so we learned that, and we reached out, and you were part of this. We reached out to the school district and we said, this vaccine is approved for 16 and older. Let's get the kids vaccinated. And we reached out to the university and said, how can we help get our university students vaccinated? And as you know, we reached out to our restaurant workers and said, how can we get our restaurant workers vaccinated? And, it kind of goes on from there, but that's been our approach, is like, wherever we can reach people, because we know vaccine hesitancy is going to become an increasing problem with the younger age groups. And as there's concern about Johnson & Johnson and other things that have come up in the news. And we're trying to just, be very transparent that we know the vaccine is working. It's absolutely working better than really other vaccines that I've experienced as far as flu or shingles and things like that. And so when we're seeing this dramatic improvement, and when we want people to be able to get back to their lives and their businesses, that's where we've really tried to help people understand that the benefits of the vaccination.
excellent. All right, get through a few more questions here within our last 10 minutes. I think this is a really great question, is, we see thousands of people each day. Quality care is delivered. At times people have, feedback for us. Sometimes people have very strong feedback for us. What is the best way for somebody to provide feedback, whether it's in the hospital setting or in our outpatient setting? I'll open that up to whoever wants to take it on, I guess.
Maybe I'll start with that. I think in the hospital, we have patient representatives, and I think that's usually, obviously first going to the care team and giving them feedback directly when appropriate and when that's reasonable. I think that's the best way to give feedback. But if there's roadblocks or it's just not working, we have patient representatives. And that's really a key way to do that. And then they loop in the appropriate, whether it be the manager, the director, myself, Elizabeth, others. And then we work with the teams to try to resolve their concerns. And that's a similar approach on the clinics. Maybe Elizabeth, you can speak a little bit more to the clinic setting and how that would be best addressed.
Yeah, I think in the clinic setting, exactly the same. The best to give feedback to directly the caregivers and the team themselves. But if you're not getting what you want there, is we have the same patient representative. Also the other way is we have a patient family advisory council. So those of you who may be very interested in becoming involved and really getting involved in shaping how we continue to care for our patients, that's another way to give feedback. We have each of our clinics has a patient family advisory council, a little small group, and then of course we have a larger one for the hospital as a whole. So there's many ways to get involved and let your voice be heard.
And I would just chime in and say that I think what you're asking is, how can you make us better? And we're absolutely committed to the voice of our community and the voice of the patient. And there are multiple avenues that are formal and informal. And we also take good feedback too, and we get a lot of it. And the reason I bring that up is it's been a challenging year for our staff and our nursing staff, our providers. It's been a difficult time, and I'm astounded by their resiliency. But I would also let you know that when we gather and I read a letter or share something that was really important and meaningful to you that made a difference in the life of you or your family member, it resonates. It sustains us. It helps us get through this pandemic and through this year. And I think we're yet to see some of the outcome of the challenge that we've had. But your words of support are incredibly powerful as well. And there are other ways to support us as well. Grant will tell you that the foundation is another way that you can help us continue to contribute and improve our efforts and give back to the community. So great question. And we do want to continue to get better and respond to what you have to say, positive, negative, or just constructive. Thanks.
So, Dr. Cruz, there's been a couple of questions related to diabetes, education in our overall program. Could you speak a little bit more in detail to what we have in place?
Yeah, sure. Many people probably just think about seeing their primary care provider when they have a disease or an issue like diabetes. But we've built this team, and which includes, of course, our nurses, our nurse care managers who can reach out, help with education, help reinforce medication changes or like how to take your insulin, et cetera. I mentioned that we do have ambulatory pharmacists. So this is a pharmacist who actually did extra education to work in primary care clinics and ambulatory clinics. So she actually is a clinician. She works with patients. So our ambulatory pharmacist happens to focus on diabetes because we decided that that's where we wanted to focus our efforts. So she actually telephonically meets with patients on a very regular basis and really helps provide that support when we make medication changes, helps our docs understand navigate some of the more complex medication regimens, and helps patients too. And then we have our diabetic educator, who, like I mentioned, can spend a lot more time, I think, than sometimes our providers may feel like they have. Sitting down, talking through diet, how do you make this work in your life? And really spending that time on education and reinforcement of some of these lifestyle changes that people can make to help their diabetes get better.
And I'll just throw in a patient example because I just had the good fortune of sending a patient to our diabetic educator, and I thought I'd been doing a great job managing this guy's diabetes and talking to him, and I kind of thought he was resistant and was not really that focused on exercise and diet, and it was amazing. Like they really got into some of the stuff that we were having trouble with. and he got a continuous glucose monitor, and she helped him interpret the readings and helped him understand how to change his diet. And then she made some suggestions. If his his labs don't improve, maybe we'd consider this. And it was remarkable. And I think I'm pretty good at managing diabetes, but I have a lot to learn too. And I think it was really helpful for us to, just to see that more team members focusing on different things can really add a lot to the care.
I think we've got time for one more question. My apologies for those I have not reached today. We're trying to get through everything. Rob, I'll allow you to answer this one. Where are we to social determinants of health, right? Has been mentioned quite a bit tonight. And where are we today versus where do you want to get in the future at a high level?
I think we're at the place where at least as an initial important step, which is the recognition of the need to address the social determinants of health. There's been no other time in my career where there's been this uniform recognition of how important it is. And with that, the inequity that we are experiencing in healthcare. And some of it is a reflection of some of the access and equity issues that we face across our entire community and socially. But we own that too in healthcare. We recognize that there are things that we can do in a much better way to be inclusive and to address all these things, whether it be the vaccine hesitancy or COVID and how it disproportionately impacted members of our community because of the group they belong to, or their beliefs, or their socioeconomic status, or the color of their skin. And so that's really important. And what it means is that we now have an opportunity to start working together to, and while investment is incredibly important, this is an area where I think a recognition of what's going on and how important it is to address it, and how critical it is also that it involves our entire community, whether it be the city, whether it be Boulder County Public Health, the schools. It's not just the responsibility of any one entity to really address this. But it's also a very exciting time. I mean, and as we come together and we really start to work towards it, I absolutely believe that this could have a tremendous impact on the health of this community. We already are fortunate to live in one of the healthiest communities in the nation, in the world. But we have so much opportunity, and we also have such a level of commitment and interest in this that we could also be an example for others to really continue to put. We have a lot of opportunity, but we could also be an example for the rest of the nation. So it's a bit of a broad sweeping answer. I would say we got a lot to do, but we're on the precipice of really being able to address this in a comprehensive way that can make a difference, not just to an individual, not just to a family, but to an entire community in a sustainable way.
Unfortunately, we are at the end of time. It's amazing how fast 90 minutes goes, but we did cover quite a bit of content. I wanted to thank all the attendees as well as our panelists tonight, both for the thoughtful questions, but also the thoughtful answers. And I think a lot of it illustrated of where we are today, but equally, maybe more important, where do we want to be in the future? Recognizing that we're continuing to raise that bar of excellence each day. And so much of it is based on this great input that we are receiving from the community. So Joe, if you don't mind going to the slide that shares where people can submit additional questions. I'll pause for a second. While Joe's putting up that slide, I'll have one last public service announcement and reminder that if you are 16 plus in the community right now, you may receive a vaccine at Boulder Community Health. You can go to our website at bch.org, or actually even more specifically, bch.org/vaccine. And that will have information there for how you can register through our My BCH portal and schedule directly. So it should be pretty easy to navigate once you hit our website. In addition, we really encourage you after now, tomorrow, after you've given this more thought, please submit through bch.org/CHNA or at bch.org/HTP. I guess either one works, on any additional questions or thoughts that you have coming out of tonight. And we will continue to report out to you in the coming months and years on how we are progressing. And again, thank you for everybody's time tonight, and be well.